I probably started having problems with my knees about 3 years ago, where I would go to a physician with problems with, aches and pains. Serious pain, I would say 2 years ago, and chronic pain over a year ago.
The decision to have a hip or knee replacement comes about when all conservative measures have failed. The orthopedic service at Barnes-Jewish West County and at Barnes-Jewish Hospital are both staffed by the orthopedic surgeons at Washington University. And we have a philosophy of basically one practice at two different hospitals. So everything we do, clinically, we do the same.
A lot of these patients are older and they have obviously debilitating arthritis, so sometimes traveling is difficult. So we can offer the convenience of our location for North County and West County patients and still provide the same kind of care that would be given to them down at Barnes-Jewish Hospital downtown.
And so it's very efficient, it's very streamlined. The floor that you're going to be on is nothing but hip or knee replacement patients. So that's all the nurses do on that floor. They'll know how to take care of your pain, they'll know how to do your therapy, and they'll know how to get you ready to go home.
Barnes-Jewish West County Hospital, for me, is kind of an example of a NASCAR driver. Every now and then you got to get off the track and pull into the pit, and this group of professionals comes out and puts new tires on you, washes your windshield, and gives you some fuel and pats you on the butt and sends you back out. And that's kind of what I felt like here. I was here for less than 36 hours and eventually much better than I was before I pulled in.
Our total joint class at Barnes West County is just a great resource for our patients and for their families. And it's much like when a couple goes to Lamaze before they have a baby, and they sort of know what to expect, and we try to lay out the path and explain what's going to happen along the way, because most people have never done this before.
It gave you an idea of what to expect and the kind of rehabilitation you would have.
There's an added element of gratification that comes from having patients who come in who are very crippled by their arthritis and come back after their surgery for their post-op visit and tell us that we've changed their lives.
They send me pictures of them water skiing and snow skiing and playing with their grandkids and doing all the things that they had to give up. And a lot of times there's tears, and patients are so grateful. And so that's certainly what keeps you coming back.
Hip and knee arthritis are very common conditions, certainly as our population ages. We now have outstanding solutions in terms of joint replacement surgery. And you've heard about these solutions from two patients and two of our orthopedic surgeons. We want you to know that we're fully committed to outstanding patient care, rapid recovery, and marked improvement in your quality of life and release of your debilitating pain. So we will continue to work to provide outstanding care both at the Barnes-Jewish Hospital and Barnes-Jewish West County sites.
I'm doing more things now than I've been doing for the last 3 years of my life, so it's amazing.
I am so thankful. I say it's one of the best things I ever did for myself.